Good morning. Myself Dr. Omkar, Assistant Professor in Physiology. Today we will see competency PY 2.1, that is describe the composition of blood and functions of blood and its components. Now blood is the fluid connective tissue present inside the blood vessels and heart. Now, blood is a complex fluid consisting of plasma and form elements. So what is plasma? Plasma is an extracellular fluid which is rich in proteins, and form elements, these are the RBCs, WBCs and platelets. So normally average blood volume in humans is around 5 to 6 liters, which is roughly 8% of the total body weight. Now total blood volume with respect to body weight, it is 70 ml per kg of body weight in an adult woman and it is 80 ml per kg of body weight in an adult man. So when we add anticoagulant to the blood and collect that blood in a hematocrit tube and centrifuge it at 3000 rpm for 30 minutes, we can see the results. So this is the whole blood in the first test tube. Now anticoagulant is added to this blood and this tube is called as hematocrit tube. Now it is placed in a centrifuge machine and the machine is run at a speed of 3000 revolutions per minute for 30 minutes. At the end of 30 minutes you can see such a picture where there is a clear supernatant fluid which we call as a plasma, which is 55% of the total, and there is a settled form elements at the bottom which is approx 45% of the total. So if we see detailed analysis in this 45%, 99.1% are erythrocytes. So the major cell in the blood is erythrocyte and rest 0.9% are leukocytes and the platelets. So this is the form elements or the cells in the blood. Now in the supernatant fluid, again it is 91% water, 8% are the proteins or the plasma proteins, and rest 1% is the other organic and inorganic constituents. Now this is another schematic diagram showing centrifugation of the blood, and you can see here we have packed RBCs, what we call as a hematocrit. Here it is cell-free plasma, and here there is a white coat called as buffy coat consisting of WBCs and platelets. So from this we have formula hematocrit is equal to height of the RBCs divided by total height of the blood column. Now the hematocrit is the fraction of total column occupied by RBCs. So the normal hematocrit is 40% for adult women. So this approximate value, it varies as per the age and different factors, and it is approximately 45% for adult men. Now the hematocrit in the newborn is 55% and it falls to approx 35% at the age of 2 months. From that 2 months of age it starts rising and it reaches adult level at the time of puberty.